Hello everyone, and welcome to this very special virtual Blue Prism world. My name is Darren Atkins and I'm the Chief Technology Officer for Automation at East Suffolk and North Essex NHS Foundation Trust. We're a large acute hospital in the east of England. I know many of you have seen me talk either in person or online, and I've told my story so many times that today I wanted to do something a little bit different and give you an insight into some of the work that myself and my team have done over the last couple of months. In very challenging circumstances, we've been able to deliver some really good quality automations that have helped the front line deliver better patient care. So before we start, just a little bit of background. I've been using Blue Prism Cloud now for well over 2 years. We started off very small with 5 bots. We're now up to 8 bots, and we're delivering many thousands of hours each month back to our hard-working staff. Using the philosophy of making time matter, it means our technology and our service is easily accessible by anybody in the organisation in a very non-threatening way. And in fact, we'll be able to help our staff do more productive tasks that they enjoy doing, and they're able to use the skills they spent years learning. But I know all of us has been through the pandemic over the last few months, and it's been really challenging times. Others have been hit harder than some, but actually it's really allowed us, or we've had to refocus the way that we engage with colleagues, with our services, using automation. So let me start by talking about how the environment has changed, how we normally do business. There's a lot of uncertainty. We're dealing with the unknown. Certainly at the start of the pandemic, we weren't really sure how things would pan out. We didn't understand what the demands on our services would be, whether we'd see a peak and a spike. But actually, dealing with the unknown also brings a lot of opportunities. There's a lack of clarity. That's a really bad thing for automation. We spend ages developing process definition documents, mapping out how the process is going to work, thinking about exceptions, thinking about the different paths we're going to follow. But actually, some of the new processes that I've been developing, they weren't defined. And in fact, they weren't being defined until we were partway through development. How did that impact the team? What sort of changes did we have to make to our engagement? There's also urgency. We didn't have time to deliver this. These solutions were developed in 24 to 48 hours if I was lucky, which meant we had to have a team who would be willing to work all night, put in a lot of hours, be very dynamic in the way we approach things. And we were able to turn around some quite complex processes, multiple bot processes, in less than 24 hours. But the environment was also constantly changing. Probably the worst mix for automation. We don't like the environment constantly changing, the goalposts moving, but they were, and we had to be dynamic and cater for that. But also we had to think different. The normal approach wasn't going to work for us. We had to think bigger. We had to take risks. We had to gamble. We had to get things done. But one thing that was absolutely certain is that I had a really good framework to support me. With the attitude of we can and we will, we were able to deliver some great quality work. So let me start by talking about what I call the success toolkit. Starting with Blue Prism Cloud. I certainly know I chose the right product to deliver automation within healthcare. Blue Prism Cloud allows me access to all the tools I need to maximize the benefit of any automation. And I can also use that product with the security that I have a world-class operation team who can support that product. And in fact, they did. I needed some rapid expansions of bot power. I needed changes made to the database size to improve performance, and it was done in an instant. And in fact, sometimes it was done before I even realized. Having vendor support is critical. I see Blue Prism not necessarily as a vendor, but probably more as a partner. I know the team very well. I've been working with them now for a couple of years. And knowing that they were there for us, the Blue Prism Good scheme was amazing. I probably got a phone call every day from people who I'd never even met in Blue Prism before saying, do you need development resource? Can we offer you more robots? Can we do work for you? Please give us something to do, which was amazing. So, technology and having the right partner was a great support at a time when we needed it, to be honest. I can't forget our talented internal team. I'm only a team of three other staff. They were amazing. All the skills that we've built up in-house over the last couple of years really came to the forefront and were tested. We had to find new solutions. We had to get a process and split it amongst 3 or 4 of us and really start working independently, but building code of a decent quality and a standard that when we brought those elements of code together, they'd work really well and streamline. But equally, we were dealing with some very critical clinical type processes. We couldn't afford to have failure. We couldn't go live with substandard code and just hope that the exception rate would be reasonable. We needed to be 100%. So whilst we were delivering code quickly, we couldn't sacrifice the standards that we developed to, but also the clinical governance that was critical for us. We also had an existing robot library. For other hospitals, they could access things like the digital exchange, which we'll talk about later. But because we already had a decent library of reusable code across a number of clinical processes and a number of clinical applications, I wouldn't say it made life easy, but it made it easier. There was a lot of pre-written scripts that we could take and reuse and repurpose, and that really did help us. Probably more importantly, and I think why the NHS has been so successful at dealing with the COVID pandemic, is we all had a common goal. And I see this a lot. In times of crisis, all the NHS and their partners come together to focus on one common goal. And when you do that, you find the barriers disappear. And that's exactly what happened. You know, the usual needs to fill in reams of paper to get justification to spend some money, or having to go and ask for approval, we just got it done. But more importantly, we never gave up. And there were a couple of times I was close to giving up and getting incredibly frustrated when the rules were changing, the goalposts would change, and the process would change halfway through, but we couldn't give up. You know, we all wanted to do our little bit to help the NHS and our patients and our community try and get through the whole COVID. So that kept us going. But one little quote I put together, which I like a lot, and it means a lot to me, is that operating in a world of uncertainty requires a toolkit that gives you the courage to push the boundaries and to do something incredible. And I think with that mix that I've already shown on the slide here, that's a great combination. And in fact, we're going to continue doing this work. The lessons that we've learned over the last couple of months, the attitude, the mentality, the motivation, we're going to keep doing that. And we're going to know we're going to deliver some really good quality stuff that we could use throughout the whole NHS and across the public sector. So I want to spend a little bit of time showing you some of the work we've done. Probably delivered around about 8 processes, I think, specifically for COVID type work. But there's 3, I think, that stand out amongst all the rest, which I'm going to share with you. So the first one to talk about is I was approached by colleagues in NHS Digital and Accenture to see how we could roll out NHS Mail to care homes. So in this particular process, care homes didn't have access to NHS Mail, a great way of communicating securely with GPs and with acute hospitals. And so what the robot did is it would receive forms that care homes would complete, it would process those forms, it would triage the information, it would check the data quality, and then it would put together almost like a technical worksheet that could be sent to the National Centre on a daily basis that would automatically be uploaded to the system, and then create the mail accounts. But this did bring some difficult challenges. No matter how clear you make instructions on a form to fill in, somebody will always do it wrong. So when I post things like, can you enter your postcode? They'll enter London or Colchester. Can you put a mobile number? No, I'll put a landline number. Some people couldn't even type their name properly. So it was a huge challenge. So a lot of the data quality fixes were done by the robot, and it was tweaked after go live. But actually, just up until towards the end of May, we've had nearly 19,000 applications verified and processed, which would have saved 1,500 hours of admin time. So, you know, even if you could have got those admin resources to do that work, it's been done a lot faster. You know, in the early days, we were putting in about 500 or 600 applications per night. It's slowed down now because obviously we've got the lion's share. Just to give you a little demo of what that looks like, hopefully you can see this here. This is just part that's actually taking the form, entering information into a spreadsheet, validating it, and then it also emails the care home to say whether their application has been successful or not. It runs really fast. It currently runs just on one bot 24 hours a day, and that's perfectly fine. Exception rate is incredibly low, and yeah, it's been really successful. So that was the first one we did. I think the core build was done in about 24 hours, which wasn't bad at all. And again, we were able to repurpose and utilize some of the work that we've done already. So that's excellent. The second one I did was around shopping delivery slots for care homes. So all of us have had challenge trying to get home deliveries during the early days of COVID. And what was important is that we got some priority slots to our care workers, the people in the care homes who needed food. So our friends at Iceland provided 1 million delivery slots, or codes effectively, which had to be pushed out to the social care organisations. Now this was a really interesting one because in order to manage the voucher codes, I was using the Blue Prism queues. And it's not untypical for us to have maybe 25,000, 30,000 items within a queue and manipulate that and manage that, and everything works perfectly well. So of course, in my wisdom, I decided to load just over 1 million line items into a Blue Prism queue. And yeah, we could say it started to go a little bit slow. But again, this is the advantage of having Blue Prism Cloud. Our colleagues at Blue Prism Cloud and the operations team noticed a degradation in the service straight away, applied a fix within about 15 minutes, increased the database size, and happy days, it just kept working. But it was eye-opening seeing 1 million transactions in a queue, I tell you. But what happened in this instance is the robot would just see how many vouchers the care home had been assigned, pick unique voucher codes, send them out with a lot of supporting information. So effectively it's like an email type bot, which was great. So, over a space of a few days, that sent vouchers to over 27,000 care homes. Again, just to show you briefly what that looks like here, it's accessing queues, it's getting the vouchers, and effectively it's sending it out to care homes. So a fairly straightforward type thing. But I think the real challenge here was just the volume of the data that the robot was managing through those queues, but it worked really well. That was a one-off. It was used once and probably never to be used again. But even so, again, a really good thing. But I think probably our biggest success to date was around the antibody testing. This was something that I published initially online on LinkedIn, and then it went quiet for a while because I couldn't share any more information. But it's done and it was running, and actually this enabled our trust to be one of the first trusts in the country to be doing antibody testing, certainly at the volume. What happens here is Blue Prism will interact with Microsoft Teams. So Microsoft Teams forms that patients can fill in their own, or staff members can fill in their own test details or the request. The request comes through to a robot who takes that information, it validates it all again. We like, even if it's been validated in the form, we like to double check it again, make sure there's a valid NHS number, make sure there's a valid email address, things like that. And then it will log on to Sunquest ICE, which is our pathology system. It will search for the patient. If the patient's not on there, it will create the patient. It will then book the test. And it does that, I think, in about 11 seconds, which is pretty quick, certainly a lot faster than what a human would do. What it then does is it waits for that physical blood to be taken, for the result to come back, and then it will look and find the results and will send them back to the patient through their chosen mechanism via text or via email. And this has been amazing. I mean, we've had so many samples come through in just the first week of operation. Again, to show you that running briefly here, just going to start it. So it logs into Sunquest ICE, which is our pathology system, just as a user would do, and it will search for the patient, find the patient, and add the order result. As all of you know, I'm sure, because you're going to be Blue Prism experts, this has been slowed down quite dramatically so you can watch it. But what's really interesting here is this Sunquest ICE system is used in so many healthcare organisations around the country that this whole process can just be taken and used. And you don't need to use Microsoft Teams. You could do any form. It could be a web-based form, or even a Word document or an email that's sent through. And you can see here now it books the result, or sorry, it doesn't book the result, books the test, enters all the key information, and then saves it and moves on, which is good. And again, this is slowed down at real speed. It runs a lot faster. So that's really good. That works very, very well. So just to mention that one of the things I want to share with you are details around the NHS Digital Exchange. So some of you may understand about Blue Prism's Digital Exchange, or DX as it's called. On there are a lot of artifacts that you can download. Some are free, I think some are by subscription, or you need to pay for them. But what's really interesting here is with Blue Prism Cloud support, we've created our own private digital exchange. What that means is, as an NHS trust, I can publish all of the work that I've done to date, my whole 2 years worth, online safely and securely. And then I can choose who I share it with. And this has been a game changer for us. It's fair to say that the vast majority of work in the exchange right now is mine. But over time that will expand and other trusts will be able to submit their work and share it. So now I'm collaborating with, I don't know, maybe 30 plus trusts around the work we're doing. And later on, we plan to align our roadmaps, or develop something different and then share on a sprint cycle 6 to 8 week basis. And here's what the digital exchange looks like. And we've had some really good feedback around that. So I know there are trusts that have taken my work already and they're reusing that. And the great thing about the DX is you don't need to take the whole process as it is. You can just take chunks that apply to you. And in fact, even if you don't want to do some of the processes that are in there, there will be little utilities within the within the processes and objects that you might want to harvest and use. So, you know, the sending of emails, the management of collections, manipulation of Excel spreadsheets, whatever it might be, it's definitely in there somewhere. So that's really exciting, and you know, this is something that will allow us to accelerate the deployment of automation across the NHS. I always say my lovely phrase that I like is by the NHS for the NHS with the NHS. You know, sharing and caring is absolutely the way. We can deliver automation in the NHS as cheap as possible, as fast as possible, using the resources from within. And yeah, I've already seen some really amazing results, and we hope that will continue. So at the start of this presentation, I told you we did things differently, and we did. We broke the rules. It was the only way we were going to deliver the work we had to deliver within such a short time frame. To start with, the process definition document, the Bible of all automation, the document that shows you step by step what a robot needs to do. We didn't have one. We had to write that after the event. We just didn't have the time. But actually our approach was slightly different in that we used Microsoft Teams to record the human doing the work and then used that as a real-time video PDD, and it worked just fine. And in fact, to some extent, we've been doing that for over a year or so, in that we used the video content to write the PDD, which worked for us. It allowed us to save so much time. And secondly, we developed on live. Developing on live was the only way we could do this work quickly, using real data in a controlled and safe way to make sure that we hit that process 100%. I'd like to take this opportunity to thank my amazing team, Lorna, Isabel, Ian. Couldn't have done it without your help. You guys were amazing. Thank you. So what happens next? The world around us has changed. We need to work in a different way. So clearly a lot of organisations within health are going to be recovering from COVID. What that means is the rebooking of appointments, bringing people in for surgery that may have been cancelled. And I've been asked a lot of times about what process do we need to develop. Well, actually, it's the business as usual processes, but it will be done in higher volume and we need to be done faster. So that's work that started and work that we will be supporting. The NHS Digital Exchange. Well, I'm going to be releasing all my COVID work on there shortly that anyone is welcome to use. What I'm also looking to do is to partner with any other public sector organisations that want to share our work. So our friends down at Suffolk County Council, we're going to be sharing with those guys, and anyone else is welcome to join. And I think that really is going to drive the deployment of automation across public sector over the next sort of 12 to 18 months. As an NHS, I'd like to push with some coding standards, knowing that when we share our work, we all develop to a consistent set of rules, the same naming conventions, the same structure for objects, which means when we get work from other organisations, we can understand it. Very, very important. And also that we can write that code as efficient as possible, so it runs faster and we can maximise the utilisation of the robots that we have on the Blue Prism Cloud platform. One of the things I've already started to experiment as well is working with clinical application providers to sort of make them automation ready. So what I mean by that is there will be a number of objects in the DX that is available to share for clinical applications. So I've already done some initial work for Doctor, for example, for their patient portal. And there's a number of other providers that I'm working with to develop that work. Again, I don't get paid for that, I do it for free. And I do it for free only because I want to make automation easier for our colleagues in health. So listen, I've probably run out of time now. I hope that was helpful for you. It's been really strange to talk into a screen and not see anybody in person. But just to say, I'm easily contactable over LinkedIn. I've also got a blog. It's called somethingincredible.co.uk. It's probably not that incredible, but it's a name that you won't forget. So please check me out on there. There's lots of video demos, there's templates, there's different ideas, and I'll happily help and support you. Just like to say thank you, a massive thank you to Blue Prism for inviting me here today, for all their help and support over the COVID period, but also to our friends and colleagues in the public sector within the NHS, all those key workers who I know have put in so much effort to get us through these tough times. So thanks for listening, and I hope to meet you all for real at some point. Thank you. Goodbye.